Dog vomiting script, MD. Hey guys, welcome back to the channel. Today we're tackling a question I probably get asked more than almost anything else in clinic. Doc, why is my dog vomiting? And look, I get it. It's one of the most common reasons owners rush their dog in, sometimes in a total panic, sometimes just a bit puzzled because their dog seems otherwise fine. And honestly, the answer to why is my dog vomiting can range from something as simple as they ate too fast, all the way to something as serious as a life-threatening emergency. So in this video, I want to walk you through exactly how I think about vomiting as a vet, what the different causes are, what signs tell us it's urgent versus something we can watch at home, and what you can actually do to help your dog. Let's get into it. First, let's clear up something really important. Vomiting and regurgitation are not the same thing, even though a lot of owners use the words interchangeably. Vomiting is an active process. You'll usually see your dog's abdomen heaving. They might drool or lick their lips beforehand, and what comes up is often partially digested food, sometimes with a yellowish bile, and it can happen a while after eating. Regurgitation, on the other hand, is a much more passive event. Food just comes back up, often still looking like whole, undigested food or even shaped like a tube from the esophagus, and there's no abdominal effort involved, it almost just falls out. This distinction actually matters a lot medically, because vomiting usually points to a problem in the stomach, intestines, or a systemic illness affecting the whole body, while regurgitation usually points to a problem with the esophagus specifically. So when you're describing this to your vet, try to pay attention to which one you're actually seeing because it really does change how we approach the diagnosis. Now let's talk about the actual causes because there are honestly quite a lot, so I'm going to group them in a way that I think will make sense to you as an owner. The first big category is dietary causes, and honestly, this is the most common reason I see dogs vomiting in clinic, especially in otherwise healthy young to middle-aged dogs. Dogs are notorious for eating things they shouldn't. This includes eating too fast. Especially in dogs that gulp their food down without chewing, the stomach gets suddenly overloaded and it just comes back up, sometimes within minutes of finishing a meal. It also includes dietary indiscretion, which is really just a fancy vet term for your dog ate garbage, literally sometimes rotting food from the bin, something they found on a walk, table scraps that are too rich or fatty for their system, or a sudden change in diet that their stomach just wasn't ready for. Fatty foods in particular are a really common trigger because they're harder to digest and can irritate the pancreas and stomach lining. I can't tell you how many vomiting cases I see after a holiday or a barbecue, where well-meaning family members have been sneaking the dog bits of sausage, gravy, or fatty meat trimmings under the table. Food intolerances or allergies can also cause vomiting, particularly if a dog is reacting to a specific ingredient in their regular diet, though this usually comes along with other symptoms too, like diarrhea or itchy skin, rather than vomiting on its own. The second big category is foreign body ingestion, and this one is really important because it can quickly become a surgical emergency. Dogs, especially younger and more curious dogs, love to chew and sometimes swallow things they absolutely shouldn't. Socks, underwear, small toys, corn cobs, bits of bone, string, rocks, and honestly, some of the strangest things you can imagine. I've pulled some genuinely surprising items out of dogs over the years. When something gets stuck in the stomach or intestines, it causes an obstruction. And the body's natural response to that blockage is to try and vomit it back up, so persistent, repeated vomiting, especially if your dog can't keep even water down, is one of the biggest red flags for a foreign body. This is genuinely one of the more urgent causes of vomiting because if that obstruction isn't relieved, it can cut off blood supply to part of the intestine, and that becomes life-threatening very quickly. The third category is infections, and this covers a range of things. Viral infections like parvovirus are a huge concern, especially in young, unvaccinated puppies. Parvo classically causes severe, repeated vomiting along with bloody, foul-smelling diarrhea, lethargy, and loss of appetite, and it can be fatal without aggressive treatment, so any young puppy with these symptoms needs to be seen urgently. Bacterial infections in the gut, sometimes from contaminated food or water, can also cause vomiting. And then there's a condition called gastroenteritis, which really just means inflammation of the stomach and intestines, and it can be triggered by a whole range of things: viruses, bacteria, dietary indiscretion, or even stress. Parasites are another cause worth mentioning. Intestinal worms, particularly in puppies or dogs that haven't been regularly dewormed, can cause vomiting along with a pot-bellied appearance, poor growth, and sometimes you'll even see worms in the vomit itself, which understandably freaks owners out quite a bit, but it's actually really useful information for us diagnostically. The fourth category is toxins and poisoning, and this is one I always want owners to be really aware of because time matters enormously here. Dogs are curious eaters, and there are a surprising number of household items that are toxic to them. Chocolate, grapes and raisins, onions and garlic, xylitol, which is found in a lot of sugar-free gum and some peanut butters, certain human medications, rodenticides, antifreeze, and various toxic plants. Vomiting is very often the body's first line of defense when something toxic has been ingested. So if you know or even suspect your dog has eaten something toxic, please don't wait around to see if they seem okay. Get in touch with your vet or an animal poison control line immediately, because for a lot of these toxins, there's a window where we can induce vomiting or give supportive treatment that makes an enormous difference to the outcome, and that window can close fast. The fifth category involves organ-related and metabolic diseases, and this is where vomiting can be a sign of something going on well beyond just the stomach. Kidney disease is a classic one. As the kidneys lose function, toxins build up in the bloodstream, and this commonly causes nausea and vomiting, often along with increased thirst and urination. Liver disease similarly can cause vomiting, along with things like lethargy, yellowing of the gums or eyes, and changes in appetite. Pancreatitis, which is inflammation of the pancreas, is another really common cause, especially in dogs who've recently had a fatty meal, and it causes quite significant abdominal pain along with vomiting. These dogs often adopt what we call a prayer position, with their front end down and their back end up, trying to relieve the pain in their abdomen. Diabetes, particularly if it's not well controlled, or if a dog develops a complication called diabetic ketoacidosis, can also cause vomiting. And Addison's disease, which involves the adrenal glands not producing enough of certain hormones, is honestly a bit of a sneaky one because it can cause vague, intermittent vomiting and lethargy that comes and goes, which can make it tricky to diagnose without specific blood tests. The sixth category is gastrointestinal conditions more broadly. Things like inflammatory bowel disease, which involves chronic inflammation of the gut lining and tends to cause recurring vomiting and diarrhea over weeks to months rather than a sudden acute episode. Ulcers in the stomach lining can also cause vomiting, sometimes with blood present, which can look like fresh red blood or like coffee grounds, which is actually digested blood, and either of those findings should prompt an urgent vet visit. And in older dogs particularly, we do have to consider tumors or masses in the stomach or intestines that can cause a partial obstruction or generally disrupt normal gut function, leading to chronic recurring vomiting. There's also a condition worth mentioning called bloat, or gastric dilatation volvulus, which is one of the true emergencies in veterinary medicine. This happens when the stomach fills with gas and then twists on itself. And it's most common in large, deep-chested breeds like Great Danes, German Shepherds, and Standard Poodles. Dogs with bloat often show what's called unproductive retching. They look like they're trying to vomit over and over, but nothing, or very little comes up, along with a visibly distended, hard abdomen, restlessness, and signs of pain. This is an absolute emergency requiring immediate surgery, and if you ever see these signs, please don't wait. Get to an emergency vet immediately, because this can become fatal within hours. The last category I want to mention is motion sickness and anxiety-related vomiting, which is honestly much more benign but still really common, especially in puppies or dogs who don't travel often. Some dogs just get carsick, similar to how some people do, and they'll drool excessively and then vomit during or shortly after a car ride. Stress and anxiety, like being at a new environment, separation anxiety, or even excitement, can also trigger vomiting in some sensitive dogs. So now that we've gone through the causes, let's talk about how to figure out what's actually going on with your own dog, because I know that's really the practical question on your mind. The first thing I always ask owners is about the pattern and timing. Is this a single, one-off vomit, or has it happened multiple times? Is it happening right after eating, which points more toward a dietary or esophageal issue, or is it happening on an empty stomach, sometimes hours after the last meal, which can point toward things like bile reflux or a more chronic gut issue? Has this been going on for a day, or has it been a recurring problem for weeks or months? Acute, sudden vomiting that resolves within a day or so in an otherwise bright, active dog is generally much less concerning than chronic, recurring vomiting or vomiting accompanied by other symptoms. The second thing I look at is what else is going on with your dog. Are they still bright, alert, and interested in their surroundings, or are they lethargic and withdrawn? Is their appetite still normal, reduced, or completely gone? Are they drinking water normally, or refusing water, or drinking excessively? Is there diarrhea alongside the vomiting? Any abdominal pain, which you might notice as your dog being reluctant to lie down normally, whimpering when their belly is touched, or that prayer position I mentioned earlier? All of these additional signs really help narrow down what's going on. The third thing that's incredibly useful is what the vomit actually looks like, as unpleasant as that is to examine. Is it food, which suggests it came up relatively soon after eating? Is it yellow or greenish, which is bile, and can suggest vomiting on an empty stomach? Is there blood, either fresh red or looking like coffee grounds? Is there anything unusual in it, like part of a toy, fabric, or worms? I know it's not exactly pleasant, but genuinely, taking note of this, or even taking a photo before you clean it up, can be really helpful information for your vet. Now here's the big question everyone wants to know. When is it actually an emergency versus something you can manage at home for a bit and monitor? I want you to treat these as red flags that mean you need to see a vet urgently. Ideally the same day, sometimes immediately depending on severity. Repeated vomiting, especially if your dog can't keep water down at all. Vomiting blood, whether fresh or the coffee ground appearance. Vomiting along with a distended, hard, or painful abdomen, especially in a large breed dog, because that could indicate bloat. Vomiting in a young puppy, particularly if unvaccinated because of the risk of parvovirus. Vomiting along with lethargy, weakness, or collapse. Vomiting along with diarrhea that's bloody or very dark and tarry looking. Known or suspected ingestion of something toxic, or a foreign object like a toy, sock, or bone. Vomiting that continues for more than 24 hours, even if it seems mild. And any vomiting in an older dog with known health conditions like kidney or liver disease, diabetes, or heart disease, because these dogs have much less reserve to cope with the fluid loss and stress that vomiting causes. On the other hand, if your dog has vomited just once or twice, they're otherwise completely bright and normal in themselves, still interested in their surroundings, not showing pain, and there's no blood or anything concerning in the vomit, it's often reasonable to monitor them closely at home for a short period, usually 12 to 24 hours, while withholding food for a few hours to let their stomach settle, then reintroducing a small amount of a bland, easily digestible diet. Speaking of which, let's talk about what you can actually do at home if your dog has had a mild, isolated vomiting episode and seems otherwise well. First, I usually suggest withholding food, though not water, for around 6 to 12 hours to give the stomach a rest. Though for very small dogs, puppies, or dogs with underlying health conditions, don't withhold food for too long without checking with your vet first, because they can be more prone to complications like low blood sugar. After that resting period, if there's been no more vomiting, you can offer small amounts of a bland diet. Plain boiled chicken breast with the skin removed and plain boiled white rice is the classic combination I recommend, given in small frequent portions rather than one big meal, because a stomach that's just been upset does much better with smaller amounts more often. If that stays down over 24 to 48 hours, you can gradually transition back to their normal diet over a few days. For water, rather than letting your dog gulp down a huge bowl all at once, which can actually trigger more vomiting, offer small amounts more frequently, maybe a few tablespoons every 20 to 30 minutes initially, and gradually increase from there if it's being tolerated well. I also always tell owners, keep a close eye during this monitoring period. If the vomiting recurs, if your dog becomes lethargic, stops drinking, shows any signs of pain, or if anything changes for the worse, that's your cue to stop the home monitoring and get to the vet, because things can change quickly, especially with some of those more serious underlying causes we talked about. Now, when you do bring your dog in for vomiting, let's talk about what we as vets are actually doing to figure out what's going on, because I think it helps owners to understand the process rather than it feeling like a mystery. We'll start with a thorough physical exam and a detailed history, which is honestly one of the most valuable diagnostic tools we have. Asking about diet, any access to toxins or foreign objects, vaccination status, other symptoms, and the pattern of vomiting, exactly like what I described above. From there, depending on what we're suspecting, we might run blood tests to check organ function, particularly kidney and liver values, blood sugar, electrolytes, and markers that can indicate pancreatitis. We often check a fecal sample for parasites. If we're worried about a foreign body or obstruction, we'll usually take X-rays, and sometimes an ultrasound gives us even more detailed information about the intestines and other abdominal organs. For young, unvaccinated puppies with concerning symptoms, we'll run a specific test for parvovirus. And in some chronic or unclear cases, we might recommend more advanced diagnostics like endoscopy, where we use a camera to actually look inside the stomach and upper intestines, sometimes taking small biopsy samples if needed. Treatment really depends entirely on the underlying cause, but there are some things that come up commonly across a lot of vomiting cases. Fluid therapy is huge. Vomiting causes dehydration and electrolyte imbalances quite quickly, so a lot of dogs, especially those who've been vomiting repeatedly, benefit enormously from fluids, sometimes given under the skin for milder cases, or through an intravenous drip for more significant dehydration or hospitalized cases. Anti-nausea medications are also really commonly used now, and these have improved a lot over recent years. They can break that vomiting cycle and make the dog feel a lot more comfortable while we're working out and treating the underlying cause. Depending on what we find, treatment might also involve antibiotics if there's a bacterial component, specific pancreatitis management with pain relief and a low-fat diet, surgery if there's an obstructing foreign body or something like bloat, deworming medication if parasites are found, or management of an underlying chronic condition like kidney disease or Addison's disease. I also want to touch on prevention, because honestly, a lot of the dietary and foreign body causes of vomiting are genuinely preventable with a few good habits. Keep your dog on a consistent, good quality diet, and if you do need to change their food, do it gradually over a week or so, mixing increasing amounts of the new food with the old, rather than switching suddenly. Be really mindful about table scraps, especially fatty or rich foods, and make sure everyone in the household, including guests, understands not to feed your dog things that aren't appropriate, no matter how convincing those puppy eyes are. Keep the bin secured, and be aware of what's within reach on counters or tables, especially if you have a dog who's a known scavenger. Puppy-proof your home for chewable, swallowable items. I know it sounds excessive sometimes, but genuinely, small toys, socks, and similar items are some of the most common things I remove surgically from dogs' stomachs and intestines. Keep toxic foods and substances well out of reach, and know which common foods and plants are dangerous for dogs. Stay on top of your dog's vaccination schedule, especially that core puppy series, because it's such an effective way to prevent diseases like parvovirus, and keep up with regular deworming according to your vet's recommended schedule. If your dog does eat quickly and tends to vomit shortly after meals, a slow feeder bowl or puzzle feeder can genuinely make a big difference because it physically forces them to eat more slowly and in smaller mouthfuls, which reduces that overloading of the stomach that triggers vomiting. For dogs who get carsick, there are some strategies that help too, avoiding feeding a full meal right before travel, taking short practice trips to help them get used to the car in a low-stress way, ensuring good ventilation, and in some cases, your vet might recommend a specific anti-nausea medication for travel if it's a persistent problem. I do want to spend a moment on something I think is really important, which is trusting your instincts as an owner. You know your dog better than anyone, and if something feels off, even if you can't quite put your finger on why, that instinct is worth listening to. I've had so many cases over the years where an owner told me, "I just know something isn't right," and they were completely correct, even before we had any test results to confirm it. Vomiting can be something completely trivial, or it can be the first sign of something quite serious. And honestly, sometimes the only way to tell the difference confidently is with a proper vet examination and some diagnostics. So please don't feel like you're overreacting by bringing your dog in, even for what might turn out to be something minor. I would always rather see a dog early for something that turns out to be nothing much than see a dog too late for something that turned out to be really serious. I also want to say, don't be tempted to give your dog human anti-nausea or anti-vomiting medications without checking with your vet first. Some human medications are genuinely toxic to dogs, and even ones that aren't toxic often need very different dosing for dogs, so please always check first rather than reaching into your own medicine cabinet. So to bring this all together, vomiting in dogs is incredibly common and has a huge range of possible causes, from something as simple and harmless as eating a bit too fast, right through to serious emergencies like bloat, foreign body obstruction, or poisoning. The key things to pay attention to are how often it's happening, whether your dog is otherwise acting normally, what the vomit actually looks like, and whether there are any other symptoms alongside it. Isolated, mild episodes in an otherwise well dog can often be monitored at home with a short period of rest for the stomach and a bland diet. But repeated vomiting, blood, lethargy, abdominal pain or distension, or vomiting in puppies and dogs with underlying health conditions should always be seen by a vet promptly. And genuinely, prevention through good feeding habits, a safe home environment, regular vaccination, and parasite control goes a really long way in reducing how often your dog experiences this in the first place. Alright guys, I really hope this helped clear up some of the confusion around dog vomiting and gave you a clearer sense of when to worry and when it's okay to just keep an eye on things at home. If you found this useful, please give the video a thumbs up, subscribe to the channel if you haven't already, and drop a comment below with any questions about your own dog's situation. I read through all of them, and a lot of the topics I cover in future videos actually come directly from what you guys ask. Thanks so much for watching, take care of your pups, and I'll see you in the next one.